Let's look at antenatal care. So the basic definition of antenatal care is health care and education given to a pregnant woman from conception to onset of labor, excluding abortion care, and is a form of preventive, promotive, and therapeutic health care. So basically, the aim of antenatal care is to have a wanted pregnancy, um, result in a healthy mother delivering a healthy baby, and the specific objectives are assessing the health status of the mother through history examination and investigations, and also identifying any risk factors that may affect the outcome of the pregnancy, and prompt intervention of complications. Also, the education of healthy lifestyle, danger signs, normal physiological changes in pregnancy, common disorders or complaints, what to expect in labor, birth preparedness, preparing, breastfeeding and immunization, and also planning the time, place, and mode of delivery, contraceptive counseling and service. So the importance of antenatal care is to promote maternal, fetal, and neonatal health, a reduction of maternal, neonatal morbidity and mortality through the um, implementation of the specific objectives of antenatal care. That is the detection of abnormalities, interventions, and education. Ideally, all prospective mothers should be educated before getting pregnant, especially in those with chronic medical conditions like diabetes, hypertension, heart disease, renal disease, and others, and also to control or cancel against pregnancy. Genetic disorders, for example, sickle cell disease, as well genetic counseling, and also selection of partners, family history of diabetes, and recurrent pregnancy loss. You basically there's an evaluation and also treatment of any treatable cause. So counseling on whether to embark on pregnancy or not. For example, in HIV or AIDS, severe heart disease, end-stage diabetes, severe hypertension with retinopathy, and also severe renal disease, unhealthy lifestyle, smoking, excessive alcohol, obesity, poor hygiene, and also no exercise, as these are examples of the unhealthy lifestyles. Basically, in antenatal care, you conduct pre-conception care too, as through the history examination investigations, you provide appropriate treatment, also health education on the lifestyle, um, like hygiene, avoidance of harmful agents to the fetus. For antenatal visits, typically um, there's a visit 4 weekly till 28 weeks, and 2 weekly till 36 weeks, and weekly till delivery. So averaging about 6 to 7 visits have been shown to give the same outcome. Okay, so a minimum of 4 visits are required by WHO. The first by 16 weeks, second 24 to 28 weeks, third 32 weeks, and the last at 36 weeks gestation. And this applies to low risk cases. Focus on antenatal care as individualized care, a skilled attendant offering all the necessary care like the education, history, and exam treatment to a client at one sitting place is required, and client friendly and interactive condition is also required. Antenatal visit, the first visit, which is a booking visit. Um, Normally, the demography, full history examination, and pelvic examination is, if indicated, must be done. Non-gravida STIs and recurrent miscarriages, you have to do these examinations. So the various investigations are, as are the booking visits. You have the pregnancy test, ultrasound, hematology, the MPs, as BF for MP, cycling, grouping, and cross matching. Resource factor, GSPD, diabetes screening like FBS, 2R, RBS, OGTT if indicated. Also infection screen, VDRL or RPR, hepatitis screening, HIV screening, to urinalysis and stool examination. And as well indicated, for example, LFT, RFT, fundoscopy. So identify any risk factors that can jeopardize the life of the fetus and that of the mother, and manage or advise accordingly. Treatment with iron, folic acid, and vitamins are very, very important. So we educate on the need to come for subsequent visits too, and the need to take up prescribed medications. And also education on the common disorders of pregnancy like nausea, vomiting, um, tiling, that's breast changes too, backache, ligament pain, postural and hormonal, headache, stress, fatigue, emotional, constipation, heartburns, increased vaginal discharges, and the cervical glandular hyperplasia. Also, edema of the lower extremities, acroparesthesia, and also dyspnea at 34 to 38 weeks, physiological skin changes, plasma, acne, striae, gravidarum, linear nigra, and also emotional instability. Let's educate on the danger signs or symptoms and pelvic like bleeding, PV, loss of fluid, um, there's loss of liquor, and also if there's any offensive discharge to abdomen, epigastric pain in severe preeclampsia or imminent eclampsia, also uterine cramps, um, in preterm labor, decreased fetal movements, in fetal jeopardy, and hyperemesis gravidarum. Also, when there are cerebral disturbances like dizziness, visual disturbance, blurred vision, double vision, persistent severe headache, severe preeclampsia, facial and hand swellings, urinary symptoms like dysuria, decreased urine output, fever and chills and jaundice, pallor, easy fatigability, and you also educate on the lifestyle, like the diet, clothes, and shoes, exercise, social concerns, personal hygiene, intermittent net use, and also birth preparedness and contraceptions too. Educate the patient on that. The risk assessment, there's an increased risk of adverse pregnancy outcome, and this is associated with extremes of age as less than 18 years and more than 35 years, grand multiparity, nulliparity, low socioeconomic status, single motherhood, smoking, alcohol, previous pregnancy loss or neonatal loss, previous years or uterine surgery, previous or current SGA, LGA, anomalous fetus, and also previous or current hypertension, diabetes, other medical conditions. So multiple pregnancies, polyhydramnios, bleeding in current pregnancy or previous pregnancy, family history of medical condition affecting the pregnancy, maternal obesity, short stature less than 1.5 and meters, rhesus negative status, any previous obstetric problem, reduced fetal movements, maternal anemia, poor weight gain, reduced lycovolume, malpresentation, uterine abnormalities. So these cases are designated as high risk and require care for tertiary centers and a more detailed evaluation and monitoring, and some may require more frequent ANC. So subsequent care after the risk assessment and low risk cases, um, these may be attended at, as for low risk cases, they can be attended at lower centers and by skilled midwives or general physicians, and also referred to tertiary centers if any risk arises. Okay, so this is called the shared antenatal care. Routine care, the following are done at specific times. I give the tetanus injection, the tetanus toxoid, IM. So at booking preferably in the second trimester, 4 weeks later, then 6 months, 1 year, and 1 year. So you give 5 doses, and also sulfadoxine pyrimethamine for intermittent treatedness. Um, as for preventing malaria in pregnancy, it's the IPTP. So sulfadoxine pyrimethamine, you give it at 16 weeks or quickening, 3 doses at 4 weeks interval, and then you supply and ensure that it has been taken. Oral GSPD. Sulfur is not is contraindicated in GSPD patients. So the HB PCV repeat at 30 to 32 weeks and also at 36 weeks. So at each subsequent visit, you review the previous notes and you take history, you perform physical examination, you do urine dipstick for protein and sugar, and you request for any indicated investigation. So ensure that the client perceives fetal movement. Weight gain is appropriate, but not more than 0.5 kilograms per week for 20 weeks. And the symphysiofundal height is should be compatible with the gestational age. The fetal heart tones are present and normal. Danger signs, if present, are appropriately evaluated and managed. And emphasize on the previous education given. Emphasize on delivery by skilled trained healthcare personnel. The delivery plan, if all is well, allow pregnancy to go to term. Do clinical pelvimetry if indicated. Short stature, pelvic deformity, nulliparous clients, also at 36 to 37 weeks, otherwise best done in labor, and decide on the mode and place of delivery at 36 to 37 weeks based on current findings. The delivery plan, you supply a list of items required for delivery, and you repeat education on what to expect in labor. You repeat education on puerperium and breast feeding, and you allow spontaneous onset of labor. Current client, the HB should be more than 10 grams per deciliter before 37 completed weeks, and let relatives donate 2 units of blood if less than this. Okay, so basically antenatal care is very, very important. It's an important means of preventing maternal and neonatal mortality and morbidity. So it should be encouraged for all pregnant women at all times.